The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
Hey, everybody, and welcome to the Senior Reset podcast. We are talking to Sonya Dunbar. She is known as the geriatric tooth fairy. She's a registered dental hygienist and has a master's of public health, soon to have a doctoral degree in gerontology. Hopefully I pronounced that right. She is going to be talking with us today about the dental issues that seniors are going to face as they get older. Like as anyone that's listened to this podcast knows, our goal is to create the education seniors need as they get into the older years, because there's no college out there. There's no educational system that's going to give us the information that seniors really deserve. And so today we're going to be talking about dental hygiene and the dental issues that seniors face. So how are you doing today, Sonya?
Absolutely amazing. And thank you for allowing me to be a guest on your show.
Oh, pleasure's all mine. Would you mind just giving us a little bit of your background and how you ended up focusing on dental issues for seniors?
Absolutely. Yes, I've been a dental hygienist for now over 30 years. And my journey started long time ago when my grandmother came to live with me, and she got really sick. She had diabetes, um, heart complications, heart disease, and I couldn't take care of her any longer at home. I had to put her in a nursing home. And then in the nursing home, I noticed that they weren't taking care of her teeth, and she had dentures, and they weren't taking out her dentures and cleaning them daily. And that's how my journey started. I started taking care of my grandmother's teeth. I started going to the nursing home. I was there every day anyway. Every morning, every evening, I was there because I felt bad. I had to put her in a nursing home, but I was doing more harm to her at home than I was for her getting the care that she needed in a long-term care facility. And I started going up there taking care of her, and I noticed they weren't taking care of her teeth. And then I started taking care of her teeth. Then I started taking care of other people's teeth in the nursing home because the staff just didn't understand, one, the importance of it, and two, how to perform that care. So that's what started my journey years ago, working in long-term care facilities, um, taking care of people, teeth in the nursing homes, and educating the staff on how to take care of it and the importance of it. So that's how my journey began, from a personal place, from someone that I love who needed the care.
So I know that you've got a business helping out facilities. You want to tell us just a few minutes about this business that you've built, taking care of seniors?
Yes, I really believe that whatever you start out with as a passion, if you really sincere about it, it can turn into profit for you. And that's what happened. I was just volunteering, going in nursing homes, just doing it for free, training the staff, brushing dentures, brushing and flossing people's teeth. And after doing that for so many years, I learned how to develop a business. So we've been in business now 8 years, providing care for residents, comprehensive dental care for residents and long-term care facilities. And we are in 2 states, about to get in 3 or 4 more, 2 to 3 more states. And we go into we service over 200 people a month in long-term care facilities, making dentures, partials, cleaning their teeth, extractions, simple fillings. But one of the most important things is educating the staff on the importance of it. And that's how we got started, and that's where we are today.
Wow, I didn't realize you guys made dentures too. That's actually something that my grandma used to do. She had a little shop in her house. I'll never forget that, like seeing her setup. So what issues do seniors face as they get older? You know, what changes are happening in their mouth that are going to be different than what they face their entire lives?
Thanks for asking that question. A lot of things. First thing is going to happen as a person become a senior over 65 and they retire. The first thing that's going to happen is their dental insurance is going to change. You know, it changes from when you're working. It puts you on a different plan. And that plan is almost like a supplement plan. And often it doesn't pay as much as your traditional insurance paid. So that's the first big change, because your dental insurance doesn't pay as much, like your PPO doesn't pay as much. It may have gone to a HMO, which you have to pay a supplement on, but it doesn't pay as much to the dentist. So at that time, you may not be a priority for the dentist to get you in. Well, they will call you every 3 to 6 months to remind you of your appointment, to remind you of the remainder of your deductible that you have. You may not get those calls anymore because at this point, you're not a priority. And that's a sad thing. And I'm not throwing dentists under the bus, but dentistry is a business. So that's the first thing. You have to make yourself a priority for dentists because your insurance has changed, the fee schedule has changed. There's a waiting list often for those type of appointments, and you're just not a priority because your insurance is not paying as much. The second thing that changes if you're on different medications. Sometimes as we age, our medication changes. If you have high blood pressure, if you have diabetes or both, if you have any sort of anxiety, asthma, sleep apnea, all of those machines or medications, the side effect to a lot of those medications is dry mouth. Xerostomia, that's dry mouth. If you have dry mouth or xerostomia, that can cause, because you don't have saliva, that can cause decay because saliva rinses away plaque on your teeth and around the gum line. But if you have a lack of saliva, that can cause decay. So now you're getting more cavities. A lot of people think as we age, we don't get decay. No, cavities are not just for kids. As we age, we get cavities as well. That's the second thing. The third thing, as we age and we have dry mouth and maybe our dexterity changes, we may begin to develop gum disease because one, we're not brushing and meeting areas like we used to. We're not able to floss because of our dexterity. Or three, we may not even remember to brush or floss if dementia is starting to set in. So those are three main things that changes as we age that we need to keep our eyes open for. And I'm just going to throw in a bonus because I am the geriatric tooth fairy. If we have teeth, if we have dentures or partials, it's important that we continue to wear those because if we take them out, like if we're not traveling as much as we need to or going to work, sometimes people, if they're not working, they take their partials out and put them in a cup because I'm not going anywhere for a week or two. But if you don't wear your partials or dentures, they won't fit like they used to. If you have a partial, this is a partial denture that hooks around certain teeth, that your teeth will shift. And then you try to put your partial in it, it won't fit. So you have to get it adjusted or get a new one. And the same with the dentures. If you have dentures and you don't wear them unless you're going out and taking pictures, they won't fit as much as they used to because you're beating your gums together and your bone decreases. So there are a lot of things that happen as we begin to age. This body just changes. It just happens to the best of us. And there's things that we need to be aware of because teeth are meant to last a lifetime. Like people tell me, some people think that their teeth are supposed to come out. No, your finger don't supposed to fall out when you get older. So your teeth are not supposed to fall out when you get older. So that's just a high level. I didn't even get into implants or things like that, but that's just a high level overview of some of the things that happen as we age.
Wow. I never thought that sleep apnea was something that might contribute to tooth decay because that is something almost every senior that I personally know either has a sleep apnea machine or they're supposed to be using one and they don't. I mean, that can cause dry mouth and that can cause gum disease and decay. That's
Especially if they have
definitely
the
new
sleep
information to me.
exactly. And especially if they have their mouth open. The mouth breathing is what gets it because it dries your mouth out.
Well, I use a sleep apnea machine myself, and even without my mouth open, I definitely wake up with dry mouth a lot of mornings. So
There you go.
yeah, that's crazy. So are there any other things that happen? I've noticed that with a lot of seniors that like the gums seem to recede a little bit as they get older. So like what kind of other changes are happening in the mouth as they get older that might cause issues?
One thing you said is receding gum line that may cause sensitivity. A lot of seniors get sensitive teeth to hot and cold. That's another thing that happens. And when your gum line recedes, that makes your roots more susceptible to root decay. So root cavities are a big thing. And also, something that I'm seeing in people that are in their late 70s and 80s, especially if they go into assisted living or long-term care, if they have implants. If they have implants or all on four, All on four is when people get all of their teeth pulled out and they have the four implants on the top, 4 to 6 implants on the top, 4 to 6 implants on the bottom, and the denture is connected to that to hold it in place, which is a great thing. But if they go into nursing homes, I see a lot of people in nursing homes that one, they don't tell the staff that they have it, or they don't remember to tell the staff, and then two, the staff doesn't know how to clean under it, or they're not aware that the person have it. So we get a lot of bacteria up under those all on fours, and sometimes they come out. I have a case that I'm dealing with now that a lady had 2 implants on her her mandibular, which is her lower jaw, in her mouth, 2 little implants. She had a lower denture connected to it. She went in the hospital. They had to take that off to put her to sleep, and it got lost in the hospital. So now she's a 78-year-old lady in a long-term care facility. Her dentist won't touch her. He's not coming there to make her another pontic over that, another denture over that pontic. So that's a situation where she can't chew. She's ashamed. Is dealing with her social her social skills. She doesn't feel comfortable going out in front of people. Nobody wants to cut those pontics out at her age with her heart condition and make her a regular denture. So we're in a situation where we're trying to get a dentist to go in and take an impression over that and make her a denture over that, like an overdenture. So there's a lot of scenarios and situations that people have to face as we age. I mean, that's why I'm glad to be on this show. So people who are not in long-term care facilities, we can tell you things that you can avoid, how to take care of your mouth now, even better, so that if we like my grandmother used to say, baby, you know where you started, but you don't know where you're going to end up. You just don't know where you're going to end up, So I try to tell people how to take care of their mouth, preventative measures as we age, so that if we do end up in a long-term care facility or an assisted living facility, we have things and steps in place to help us.
So, you see it all the time on like TV commercials, 8 out of 9 dental hygienists or dentists recommend this or that. And you're talking about tooth sensitivity and different things like that. Do those actually work? If you are having a receding gum line and it's getting sensitive, well, like the toothpaste that claim to reduce sensitivity, do they actually help with that?
Yes, most of them work. A lot of times, if you see toothpaste with fluoride in it, that helps out. That a lot of those sensitive toothpaste, the fluoride helps reduce decay. And if they have Sensodyne, if it's some sort of Sensodyne toothpaste or sensitive toothpaste, those usually help out.
Okay, cool. Good to know.
The best thing is to make sure that you make your regular dental appointments. Go in and tell your dentist or dental hygienist that you want fluoride applied. A lot of times, as we age, our dental insurance may not pay for us to get fluoride because that's something they do for kids. But tell them, say, I want fluoride because I have receding gums and I have sensitive teeth. Do a fluoride varnish on me. You can request that. That helps out. Toothpaste or any sort of mouthwash with xylitol in it. I'm a huge fan, and I'm not pushing any
Really,
product.
the artificial or not artificial sweetener, the
Xylitol.
the low
Xylitol.
calorie sweetener,
Yeah,
xylitol.
xylitol is amazing. So I use a toothpaste called Always, and you only can get it from your dental professional. But oh my gosh, do I love it! It helps with sensitive teeth. And it helps with dry mouth, because I'm in the stage and I'm in menopause, and my mouth, my eyes, my nose are very dry. So I use the xylitol, the Always, because it has xylitol and it just makes and it has a spray. It makes my mouth just feel so good. And it also helps reduce decay. So I'm getting 2 for 1, a great feeling toothpaste. It gets rid of the dry mouth. It has a spray to go with it, because when your mouth is dry, your breath smells. So it's just a snowball going on. So yeah.
I had no idea xylitol was good for your teeth. So that's interesting. I knew what it was, but I had no idea that it was good for your teeth like that.
Mm-hmm.
So let's talk about daily habits. So they say brush twice a day. Most people maybe once a day actually do it. Are there changes as you get older in your dental hygiene habits that you need to make to try to keep your teeth right? Or is the regular, brush twice a day or 3 times a day, depending, is all that just still the same best practice?
Well, I'm so glad you asked me that, Joel. Joel, I didn't mean to say
Yep,
Joe.
it's fine.
I'm glad you asked me that. One of the biggest things that I can tell people as we age is to get an electric brush, because as we age, we just, one, don't brush as long as we should, and two, we do not hit every area like we should. So there's two key things I'm going to say here. I'm a big component of an electric brush. I don't care whether it's the long one or the circle one. Use an electric brush, because that way you have a better chance of removing that decay. Now, with the electric brush, this is how you use it. A lot of people use electric brushes wrong. When you go to the dentist, when they polish your teeth, they go on one tooth at a time and they polish, they polish, they polish. When people, that's how you're supposed to do with your electric brush. Lay it at the gum line and sit there. Move it again, move it again. But a lot of people take electric brushes and they move it like a toothbrush. You're not supposed to move an electric brush like a toothbrush. You're supposed to sit it in one area, sit it in another area, sit it in, and just move it around like that, all around your mouth. That's the way you use an electric brush. You don't brush.
It's already moving like 100 times a second. So, moving
Right.
it
So
with your
you
hand
don't need
back
to,
and forth isn't doing anything.
it doesn't do it. And
Yeah.
you're missing what you're not allowing the brush to do what it's supposed to do. So that's one key I'm going to give you. The second key is get a water pick, especially if you have bridges and crowns. Now, I'm gonna have to put a disclaimer out there so any dental hygienist listening will not grow horns. Water pick does not replace flossing. Okay, nothing replaces flossing. But as we age, our dexterity gets different, and sometimes it's difficult for us to floss. So if you cannot floss like you should, get a water pick, get some interdental picks, like those little picks with the little yarn of floss on one end and pick on the other. Use that in between where you can, and use a water pick, and that will help you. And you need to brush twice a day. You have to, as we get older, our oral care skills need to go up, because if you get in a long-term care facility and you get decay on your teeth, it's so hard. It's challenging. It's challenging to get a dental professional to come in and remove those teeth. And if you're in a wheelchair on a jerry bed and you can't transfer yourself, it's difficult to find a dentist that has a place where you can move your wheelchair in and they can service you. Because people in nursing homes, when they get out of bed, most of the times they have a hoarder that lifts them up and put them in a wheelchair. So when we service people, we service them either in their bed or in the wheelchair. But if someone has to go to the dentist, who's going to lift them out of their wheelchair into the dental chair if they have a problem standing up? What dentist wants that liability of someone falling in their office? And most dental chairs are stationary in the dental office. So you want to take care of your teeth as long as you can yourself so that you don't have these problems as you begin to age.
Yeah, it's kind of funny. The story that's getting painted is that once you hit 65 and you start getting older, when you probably need the dental care the most, the coverage declines or you lose it entirely. I know several seniors who just don't pay for the supplement. They just pay everything for dental out of pocket, which means they're probably not getting as much dental care as they need. And so when you need it the most, the coverage declines. So in implementing those best practices at home can help keep the money in your pocket, I guess, as well as a lot of uncomfortability. Nobody likes the feeling of sensitive teeth. All of that stuff is extremely painful. So use an electric toothbrush, get a water pick, make sure that you start doing it twice a day if you're not yet. That is all incredible advice, I'm thinking.
Can I throw another geriatric tooth fairy tip in there?
Oh, for sure.
Let me tell you something. Dental professionals are human. They're human beings. So, and this, if you've been going to your dentist for 10 to 15 years and you know your supplement is about to change, listen, your dental office never had a problem coming to you and breaking down your treatment plan to you, letting you know when you had to pay and what you had to pay. They'll take you in another little room and sit down and talk to you, break it down and what your insurance is going to cover and what you're responsible for. So I'm a big component of you having courageous conversations with your dentist. Say, listen, hey, Dr. Happy, I'm retiring in a year, and this is the supplement I'm going to have. So what type of plan can we work out that I can come in and get an exam and a cleaning every year, and I could pay you if twice a year, and I can pay you? What can we work out? And then be quiet and let them give you an answer. Because if you patronize their business for 10 to 15 years, they're more than likely to work with you. But we have to make ourselves a priority because they're moving, they're quick moving. So, but if you tell them that, have that conversation, they're human. Most dentists want to help. They want to see your teeth last a lifetime. Does this make sense?
Yeah, it makes a
Okay.
lot of sense. Yeah. So what's what are some of the dental related problems that seniors might be living with that they really shouldn't be? That like what are some things that, if a senior is listening to this and they know that they've got, they haven't been taking care of their teeth, what are some things that they can't, or what are some things that they really need to see somebody about that could really cause problems if they don't?
You asking that question. First, start off with ill-fitting dentures. If you have to put gobs and gobs and gobs of fixative in your denture, you need a reline or a new set of dentures. Oftentimes, people think the dentures are meant to last a lifetime. They're not. The lifespan of dentures is 5 years. So if you haven't lost your dental insurance yet and you've gotten your dentures made years ago, go ahead and get another set made before you lose your dental insurance. If they're ill-fitting, there's nothing wrong with having two sets. So, or get a reline on them. Start that now. Get that process going now. If you have to wear gobs or fix it, that's not normal. Same with your partial. If your partial's moving around when you're talking, if your denture's flopping, get that adjusted. Get that taken care of. 2, if your gums bleed when you brush, if your gums bleed, because teeth don't bleed, it's your gums. If you brush your teeth and your toothbrush is pink, or you spit in the sink your toothpaste and it's pink, go see a doctor. Go see your dental professional. Because if your eye start bleeding, you're gonna beat everybody to the emergency room. If you rub your eye and it bleeds, you're gonna go to the emergency room because that's not normal. Gums bleeding is not normal. It's a sign of disease. That's the next big thing you can do. Get that under control. Get that disease situation under control because the body is giving you a sign. Something's going on here. There's some plaque, there's some debris, there's something going on. And if you have any pain, whether it's tooth sensitivity, when you eat something sweet or a tooth that hurts every now and then, that's that tooth saying, listen, I'm going to wake up on you when you least aware. So those 3 things, dentures, ill-fitting. 2, any blood in your mouth. And 3, any pain, go see your dental professional. Let them know what's going on. Don't say it hurts every now and then. No, it's not going to heal itself. It's going to get worse. So grab it, get it when it first knock on your door. Don't let it beat on the door hard. It's giving you a warning. And then when it wakes you up at 2 o'clock in the morning, your eyes are going to go.
Yeah. Well, with the gum bleeding thing, it seems like to me, every time I've realized that I'm not properly brushing or I haven't been, flossing like I should, my gums bleed for a little bit and then they stop after a couple of days. Is there like a rule of thumb for that? I realized I use an electric brush, which I love, but I realized that I wasn't getting behind on my front teeth properly. And so it was a teeny bit sensitive and I just kind of put my electric brush on it every day. And it was bleeding initially when I would put extra emphasis on it, but then after about a week, it stopped. Is there like a rule of thumb on the bleeding gums on when you should see a doctor and
Yeah,
when it becomes a
just
problem?
stop. Yeah, and that's common. If you have an area that's a little sensitive, it get a little swole, that's just letting your body letting you know, hey, it's plaque under here. It's irritating me. Get it out like a splinter. And it's a splinter. As long as that splinter's in your finger, it's going to irritate you. Once you get the splinter out, your body's going to heal up around it. It may be a little tender, but that's how it's going to happen. But if you just ignore that and the bleeding continues and is in more than one area, then you need to go to the dentist. But you should always have regular dental visits every 6 months on the minimum. Every 6 months. But if the bleeding doesn't stop, if you brush that area and it's still bleeding, you floss it and it's still bleeding, you rinse with it, and it's still bleeding, and yeah, definitely you should go to the dentist about that. Just call, say, listen, I got a spot that's bleeding because it could be developing a pocket or something there. So you want to get that taken care of before it gets worse.
Now, you'd mentioned earlier in the beginning that medications can kind of mess with your gums, with your teeth. Can you expand on that a little bit? Like maybe what kind of medications might cause more issues or what kind of issues the medications might be causing?
People who have seizures, that dilatin, I think that's what they take. A lot of times their gums swell up, and they have a lot of plaque and different things around their gums that needs a lot of extra attention. Any sort of women that's taking some menopause medications, Those sort of medications may make your gums a little sensitive and may cause bleeding. Medications that dry your mouth out, like I mentioned earlier, anybody that takes any sort of asthma medication or medication for antidepressants and any medications for like diabetes and high blood pressures, those medications sometimes tend to dry out your mouth, and those can have an adverse effect on the health of your gums.
That's the main issue, is that it can cause the dry mouth, and then that can cause the gum disease from the dry mouth is the main
Yes.
issue. And then there are there any issues with like dentists overperforming procedures on seniors? You know, we talked a lot about, maybe not being able to get enough care, but are there any issues the other way where, there might be predatory dentists out there that are just trying to get as much money as they can, or anything like that? Maybe not predatory, but,
Harsh word.
I don't, maybe that's a harsh word.
I think that there's anybody out there that's taking advantage. It's a dental professional that's made a oath to take care of people, that they're going to be make victimizing people. But I do find an issue where you have like 85-year-old people with dexterity issues and some early signs of dementia getting full implants in their mouth. You know, that's because those type of people that most of the time end up in long-term care facilities, which I see, like I said earlier, the staff is not aware of how to take care of the dentures, the overdenture, or how to clean around the implants. And it's in if someone has dementia, they have severe uncontrolled diabetes or past cancer patient or osteoporosis, those people are not good candidates for implants. And I hate to see people in dexterity problems. I hate to see those type of people get implants because they end up in long-term care facilities and they fail because they're not being properly cared for, they're not being cleaned, and it just people have paid a lot of money, and it doesn't seem fair. And I'll
But-
say that as best as I can,
so
tiptoeing
following up on
around the
that, like,
ethics in that.
people that get implants or get dentures, they don't really have, they're not even have their own teeth anymore. What do you need to do for dental care when they're not real teeth? Do you treat them just like regular teeth and keep them brushed, or, you know,
Sure. Oh, yes. Dentures, let me tell you something. I'm glad you asked that. Let's go down this street. First of all, you should never sleep in dentures. If someone has dentures, you shouldn't sleep in dentures. There's something called denture pneumonia, because plaque, the same plaque that grows on teeth, the plaque grows on dentures. And when people sleep, if there's food particles or if there's plaque on their dentures, they sleep, we deep inhale when we sleep, and that bacteria could get in our lungs and could cause pneumonia, aspiration pneumonia. So people, one, should not sleep in dentures. Two, you should all, and if you do sleep in them, which they don't recommend, but some people have to sleep in them because they're wearing a CPAP and they have to keep their mouth a certain way. You need to clean your dentures. Clean them. Dentures need to, and I hear people say, well, I soak my dentures. No, you need to brush your dentures. Brush them because there's food particle and plaque on them. They need to be brushed. And the second thing, not with toothpaste. You should never use toothpaste on your denture because toothpaste are for teeth. Dentures are acrylic, they're not real teeth. So when you brush your dentures with toothpaste, you put little scratches in your dentures, and bacteria grows in there. So you need to use denture toothpaste. There's a amazing toothpaste that I highly recommend called Cleanadent by Dr. Berlin. I think it's at Walmart or CVS, but I know it's on Amazon. That's the best denture cleaner in the world to me. That's the only thing I recommend. I would use it on my grandmother. He's not paying me to say anything about this, but I love the Cleanadent. But if you don't have toothpaste, use soap. Use dishwashing liquid. It's not as abrasive as toothpaste. But you should always brush your dentures before you soak them. You need to soak them all the time. And you should not always wear your dentures. You need to take your dentures out and let your gums breathe. Now, I think I look good. I just do. And if I have fake teeth, I don't think I would take them out long. I'll probably take them out in the shower, throw some water on my gums, maybe at the blow dry hit them, and then they'll go right back in. So I don't think I would walk around without my teeth in if I had fake teeth. So I understand some people won't wear them, won't take them out, but your gums need to breathe sometimes. You need to kind of take your dentures out and let your gums breathe. Wearing your dentures all the time, it's like wearing gym shoes after they got wet and just wearing them all summer long and never taking them off. Can you imagine how those gym shoes gonna smell?
That'd be pretty
So
bad.
yeah, so you got to take those dentures out, brush them, soak them, and let your gums breathe.
All right. Is there anything, because we may have, people that have caregivers or, PCAs that might be listening to this. Is there anything that they should be keeping an eye out for with the seniors that they're caring for?
Absolutely. If you have a nonverbal senior, if they're pulling on their jaw, if they're pulling on their face, if they stop eating, if they're packing food, maybe they need to see a dental professional. And try as much as you can to have them brush and take care of their own teeth as long as they can. The more independent someone is, the better. And if you can get them an electric brush, that's even better. Even if you have to get the little $8 electric brush from one of those dollar stores or something like that, they have them there. But you can use that, put a battery in it. But anything that can help them brush their teeth, as long as they can't do it independently, that would be great.
Awesome. Do you have any other geriatric tooth fairy tips for us today?
Thank you for asking. Well, I do have one more that I keep in the pocket. I
I'll
want to
take it.
tell anybody that if you get sick, if you get a cold, throw away your toothbrush. If you have a cold or even you get COVID, if you keep using the same toothbrush every day, you're just re-affecting yourself. So first things first, if you have an electric brush and you get a cold, the flu or anything, put your electric brush away. Send somebody to the store, get a whole bunch of those cheapy toothbrushes, use a different brush every day and throw it away. You can go to one of those dollar stores and get a $1.25 brush or whatever it costs. But don't keep reinfecting yourself, because that'll make that cold last a little longer. Because if you keep using the same brush and brushing your teeth and brushing your tongue, come on, that's not
Yeah,
good.
I always thought that like the toothpaste was like it doesn't disinfect or anything. Nothing.
Is it? I mean, I don't know what toothpaste you reading. You use it, but read the back of it and see if it says it
Oh, I'm
disinfects.
sure it doesn't. I just always kind of assumed because it makes your mouth taste so minty. So wow. All right. Yeah, no, with a lot of the, with the electric toothbrushes too, once you're, if you're sick, you can even toss out the top and just get a new top
Hmm.
for it. So yeah, and the price on those has gone down. So if there's anybody out there listening that's a senior and you remember from like 10 or 15 years ago when the only electric toothbrush cost like $120, it is not that way anymore. They are very affordable. You can get them for kids for a couple bucks even. We got them for our kids. Yeah, $8 or $10. You can get some of the lower end ones, and that can brush way faster than you'll ever brush.
Yeah.
All right. Well, I appreciate having you on today. Where can people find you if they want more words of wisdom?
Absolutely. And thank you. If you would like me to come speak at your nursing home, your senior organization, your senior group, I can be reached at sonyadunbar.com or on my Facebook, Geriatric Tooth Fairy. But I'm always happy to share ideas, oral cancer screening tips, oral care tips, whatever I can to help our seniors age and keep their teeth for a lifetime.
All right. Well, thank you very much for coming on and talking with us, Sonya. And for everybody else, we'll catch you on the next episode.
Bye.
You've been listening to the Senior Reset Podcast. If you found today's episode helpful, please consider sharing with the seniors in your life so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care. Always consult your doctor if you have a medical issue.